Americans are better at setting up appointments for routine car maintenance than setting up appointments for routine cancer screenings. That's all according to a new survey. And for the first time, the Prevent Cancer Foundation surveyed how many people are missing those important early detection cancer screenings and why. Our Sally Hernandez sat down with the CEO of the group behind that research for a closer look at the numbers.
Jody, let's talk about the most recent survey and what it says about cancer screenings.
What we found actually through our early detection survey was that people are better about their routine car maintenance, like oil changes, than they are about their routine health appointments. In fact, 65% of Americans age 21 and older are not up to date with at least one of their routine cancer screenings. And that's an important issue because routine screenings really give us the chance to have a cancer either prevented or detected in the earliest stages when treatment is much more likely to be effective.
Why are people delaying their screenings? Did they give a reason for that?
They did, and there can be many reasons or barriers to people receiving health care. What we heard most often is people simply didn't know they needed to be screened. Many others also reported that they didn't think they needed to be screened because they weren't experiencing signs or symptoms. And we want people to go and get their appointments before experiencing signs or symptoms.
What do you think is going to help people kind of turn the corner and realize that this is something they need to do?
Education and easy to use information is really an effective way to help people prioritize their own health. What we found was that when people were presented with information about the importance of early detection, they were more likely to act. And so we created the Early Detection Equals Better Outcomes campaign so we can provide really easy to use information about the screenings you need at every age, how to talk to your loved ones about family history of cancer, and the ability to book appointments right from our website. We all have a lot going on, and we want to make it as easy as possible for people to be proactive about their own health.
Jody, oh yes, thank you so much for joining us.
You're welcome. Thank you for having me.